Okay, so I have the pleasure of introducing Dr. Mladen Golubic. He is the medical director for the Cleveland Clinic Center for Lifestyle Medicine and a very long-time friend of mine. The thing that impresses me the most is that for over 20 years that I've known him, he lives and breathes this. Like he really believes it, and I think that's what makes him real. So I think this is going to be really interesting for everybody to listen to.
Hello, everybody. It seems that I'm the only thing that stands between you and your lunch. And not only this, I'll be talking about food, so just want to make a disclaimer that I'll not be looking at your dishes, okay? It's my pleasure to be here. Thank you for this great opportunity to present. And so I'll focus on lifestyle medicine, and it was mentioned here before. Thinking about how will I approach this and have 15 minutes to talk about this great topic, I thought I'll start with the unknown civilization at the edge of galaxy coming, finding our planet, discovering there is intelligent life, and deciding to land, okay? And so maybe they would decide to pick, I don't know, Split or Dubrovnik. But they landed in 14th century, okay? And that was at the peak of the epidemics of the bubonic plague, when 1/3 of European population died in a very short period of time, okay? So at that time, we didn't have any clue what was going on. We didn't know what is causing the disease, how it spread, how can we prevent it, how can we treat it, yeah? Now, fast forward, if these aliens would land in 21st century, well, they would find that we are dying from diseases that are caused by our lifestyle choices. These are not communicable infectious diseases. Yeah? The number one in the US, this is shown here in red graphs, is cardiovascular disease, cancer. Worldwide cardiovascular disease and cancer. It's not tuberculosis, AIDS, and infectious diseases. Yeah? Now, what are the real causes of those illnesses? And those are listed here. We know this for more than 20 years. Is tobacco, smoking, poor food choices, and lack of physical activity. Those are the major ones. And those are the ones that we can all control. And I mentioned Maria, she asked me, to be sure that I'll be within 15 minutes. And I said, I'll mention in the first 5 slides everything what you need to know. And that's the slide. These are the real causes of illnesses that are the major killers of men and women in 21st century. Just quick example, cardiovascular disease. Anybody who has heart attack has one of these things, one of these risk factors. High cholesterol, high blood sugar, high blood pressure, or a smoker. And they are all lifestyle related. Yeah? The guidelines call for first line of intervention is implement lifestyle changes. This is for cholesterol. You can see here for high blood pressure. You can see here for diabetes. And it's very specific. There are 13 steps. The first one is lifestyle intervention. Okay? So those guidelines created a need to have a new field in medicine, subspecialty called lifestyle medicine. Because we use lifestyle intervention as the primary therapeutic tool, not medications, not procedures. Yeah? And when I say lifestyle, I mean physical activity, nutrition, and learning how to cook, prepare foods, and stress relief, stress reduction. Yeah? And then comes not smoking, and not over drinking, etc. So how do we do this? And this is the key feature that I think I see almost every day when I see patients. They come, they probably read Mark Twain. I know what I need to do, but I don't like that. Yeah? I don't want to exercise because it's not fun. I sweat. Yeah? So this is what we can do, and we have used this in clinical work for the past 10 years, and we have publications. I didn't go into this. This is more for you, what we can do as a society and as individuals to address this epidemic of preventable diseases. So number one is be more active. And these are the guidelines from last year. I highlighted 2 of those. Move more. Every step, every movement counts. We are sitting here the whole day, yeah? So try to stand up and move and be as active as you can. And number 2 that I put here that is important to understand, people who are sedentary, who are so-called couch potatoes that we like to say, yeah? They benefit the most. 15 minutes extra movement, you have benefits. Stronger muscles, stronger brain, less stress, much better mood, yeah? The excuse here in Cleveland is for half a year people say, you know, it's too cold, I cannot walk, yeah? And for another half year it's too hot, I cannot walk, yeah? So we have malls. You can buy membership in a gym, but just be mindful. I mean, you can use stairs rather than escalators, yeah? The same thing. You see this hotel, there are no stairs. You have to use escalators, yeah? Now you can walk in escalators, okay? Don't walk your dog like this, yeah? There are people, those who have pets, who have dogs, they have lower body mass index, they are healthier. But unless they do it this way, they are not going to benefit, yeah? So dietary choices. This is the leading preventable cause of our illnesses, yeah? And it impacts our gene expressions, and we have heard how important those things are. When it comes to diet, it's almost like with the pills, you know, doctor, which one should I take, the blue one or the red one, yeah? Which one is the right one, yeah? So usually people go and, unfortunately, the fiction section of bookstores about diets is enormous, yeah? So this is one that is very popular these days, like ketogenic diets, yeah? I mean, the evidence is so weak. Maybe in 10, 20 years we will have and move it into the non-fiction. So what I'll mention here briefly is the American College of Lifestyle Medicine. When you have experts who are dedicated to lifestyle interventions, and then you look objectively at a variety of studies, and so what you conclude is that the eating pattern used for prevention, management, and treatment of chronic diseases, yeah, is predominantly plant-based. Vegetables, fruits, whole grains, legumes, seeds, yeah? So, this is what we teach our patients, and message for you. If you want to be healthier, eat more plant foods. The key component is that you eat unrefined, unprocessed whole foods. Because you can eat only plants, and if those are refined, you are not going to benefit yourself. So clearly you can move to Mediterranean diet, you can move to fully plant-based diet. And also, like with exercise, you want to avoid being sedentary. In diet, you want to avoid taking foods that are dangerous, that are carcinogenic, like red and processed meats, yeah? So that's why I always feel awkward speaking before lunch, you know, it's much easier after lunch. So, this is the only side effect that I was able to find in medical literature when you eat more plants, more beans, more vegetables, yeah? You have gas, you have flatulence, yeah? And some people believe it contributes to global warming. Now, this is what is the major driver of greenhouse gases, yeah? It's the livestock. Now, this is a great recent article in New York Times, and I encourage you to check it out. There are many, many ways how we can improve our food choices, starting from schools, farm bills, how we prepare the foods, how we deliver them, all kinds of elements. But the key one is we need to educate professionals about nutrition, because during medical school training fellowships, we learn nothing about it. And those are the key drivers of chronic diseases, yeah? And if we want to use food as medicine, we have to implement it in the healthcare system. It's not implemented, it doesn't mean it doesn't work, yeah? So, Dr. Mihaljevic mentioned this yesterday, social determinants of health. If you look what determines outcomes in health, in society, only 10% is due to our healthcare system, which is kind of very disappointing for us working in the healthcare, yeah? We are just contributing so little. The most are our behaviors. And of course, social determinants of health. Do you have access to food? Can you afford it? Yeah? And so in order to really make a change in society, we need to focus on those things. So we try to educate our patients about culinary literacy. Yeah, we need to know how to cook. It's forgotten art. We don't know how to prepare foods and prepare them in healthy ways. So we are members of Teaching Kitchen Collaborative, which is a national institution. There are 30 members, and trying to develop the best practices, evaluate those, how to teach patients, how to teach students, how to teach public in general. So if there is any recommendation, if you want to ignore everything what I said, just don't ignore one thing. Chew well and eat slowly and mindfully, okay? Whatever you want to continue eating, I'm fine with this. It's your responsibility. It's not mine. But just remember, we are very, very rushed. We are stressed. Yeah, don't chew like this. Yeah, this is the world recorder in hot dogs. Yeah, 69 in 12 minutes, okay? Now, even if you eat fully plant-based diet, don't chew like this guy. This is the collard greens. He's a champion, world champion, 2.5 pounds of cooked collard greens in 17.5 seconds, all right? And don't chew like Popeye, yeah. The point that I'm trying to make, we need to eat, and we lost that art of sharing the bread, sitting, enjoying, yeah? And that's because of this, yeah? The new research shows that we are 80% stress and 20% water, yeah? Maybe we are sometimes 90% stress, yeah? So, how do we do this? Clearly having friends, it's a wonderful stress reliever. It's the best one, yeah? So by any means, call your buddy, get together. Having purpose, meaning in life, I think everybody who is here probably has it. Physical activity, we talked about it. And then the formal practice of those techniques that elicit relaxation response. And we know how to do this, we just don't use them, yeah? We can do yoga. For example, this is from our publication, and there are no excuses, yeah? Oh, I'm too old, you know, I cannot do this, yeah? We teach our patients chair yoga. Yeah? If you had stroke, you had other disabilities, you can do it. Yeah? Meditation. Yeah? It doesn't have to be sitting like this, cross-legged. You can lay down and before you go to sleep. And there are many, many techniques. If you have cell phone, you have access to probably 20 different meditation apps. Yeah? There is no need to go to a cave in Tibet and learn how to meditate. Yeah? We are in 21st century. And physicians, of course, need to meditate. So, those are some of the benefits that you experience when you quiet down. And you would think, that's habit forming. And it is. Yeah. The key factor is we need to take patients, or whoever wants to do it, for the hand and let them experience this. We have seen physicians who suddenly discover that 10 minutes of peace is just a wonderful thing because we don't stop. Yeah. And that will enable us to change that idea, because fear of death is not a good motivator. I just talked to Dr. Kicic. You have a person who just had 2 stents, who received 2 stents, and 2 weeks later he's back to smoking. Yeah? Fear of death, it doesn't motivate you, but joy of living it is. And I think that's where we need to focus, on these positive aspects of taking good care of ourselves. When we feel good, we irradiate this and we want to continue. So I'll be finishing here. I have 2 more minutes. Those of you who are in Cleveland, this is our number. You can come and see us. I hope we'll share the slides. Experiment. Don't be afraid. Yes, try cooking. Try different meditation techniques. Try yoga, tai chi, qigong. Yeah. And evolution versus revolution. Revolutions do not last long. Go slowly. Do small changes. 10 minutes more. Yeah. Of walking, 5 minutes meditation. This is our center. And when you change your lifestyle, you impact people around you. Yeah? You impact your community. And those are the key challenges of our time. Climate change and chronic diseases. This is what we do in medical care now. We are mopping the floor. That's what Dr. Mihaljevic was talking yesterday. We are firefighters. Yeah? We are trying to extinguish fires. We need to go way back and go at the root causes, and those are the lifestyle changes. And we need you. We need to stop this faucet. We cannot do it. Medicine cannot do it by ourselves. We need everybody to work on this, stopping that faucet. Otherwise, we'll bankrupt the society. American College of Physicians, we need to educate public about climate effects of our choices. Yeah? And Nature magazine is involved. Scientists agree that climate change is a big deal. Religious leaders agree that this is the the case. When do you see in modern times that science and religion are fully compatible? They all agree the same thing, yeah? So we have tremendous power. We just need to move more to plant-based eating, and we need to make sure that we don't waste food. Our grandparents would be turning in grave if they would see how much food we waste, yeah? So go meatless on Mondays, wonderful, nice step. It's not sufficient. We need to do far more, yeah? The question is, people say we need to save the earth. The earth will take the care of itself. We need to save us. That's the key. This is how it can be in the future. He said, I see I cannot read from here that there is a peace throughout the world. It says, well, yeah, I see, but there are no humans, yeah? Yeah? It's peace. So think about it. We are stuck on this world. The closest one just discovered recently that has water in the atmosphere is 111 light years away, okay? So our great-great-grandchildren probably will not have spaceships to go there. So we are stuck here. We need to take good care of it. And with this, I will stop. And thank you very much.